invite you to take a breather, to listen to a group of people who came together around a big problem, came with different experiences and points of view, who decided to work collaboratively to see if they could find common ground and hammer out a practical approach to this complex problem of long-term services and supports.
Everyone involved in these efforts hope that the sensible and evidence-based ideas presented today and the breadth of voices behind them will lend momentum to public policy and private actions that will ease the crushing financial burdens that too many Americans face in caring for themselves and their loved ones.
The number of Americans estimated to need long-term services and supports is expected to more than double, from 12 million to 27 million in 2050, while the costs of long-term services and supports are expected to grow from 1.3 to 3% of GDP. And families, as we know, are increasingly struggling to prepare for and to afford necessary care. And while there is, in fact, considerable consensus on how care should be delivered, preferably at home, as Alice pointed out, those days of people essentially going to nursing homes have declined and are continuing to decline, and it is a preference, people's preference to stay at home. There is a very deep divide about how to finance those needs going forward. The financing and delivery of long-term services and supports is an issue of a long and complex history. Public programs spend well over $100 billion a year on these services, and unpaid caregivers, such as family members and friends, contribute services that are worth more than $400 billion a year.
So how can we build a financing system that fills those gaps and strengthens those weaknesses, exactly the framework that Dr. Rivlin presented earlier? And how can we make it work for the realities of those facing care needs? After much debate, we chose to endorse a universal public program. We did this for several reasons. We could not identify any other approach that was affordable, feasible, and shifted long-term care financing from the welfare-based model we have today to the hybrid public and private insurance system the collaborative supports. Actuarial analysis convinced us that voluntary back-end insurance would fail. Premiums would be too high, and we could not solve the challenges of adverse selection. Some will certainly object to this idea on the grounds that it creates a new government program. But it was our view that the government already has a catastrophic long-term care program. It's called Medicaid. And we felt that insurance would be a better substitute for, particularly for middle-income people. So for many Americans, we'd shift long-term care from a welfare-based program to insurance. Carefully designed, such a catastrophic program could reduce Medicaid LTSS costs by more than a third. But back-end insurance still won't cover every dollar of LTSS costs. That's why we also support efforts to increase private savings and allow people to more efficiently tap home equity. Because for many people, private long-term care insurance could help fill the gaps left by the public catastrophic program, we suggested ways to make that private insurance more affordable. We also recognized that many Americans would still need to rely on Medicaid. Our goal was to create a better Medicaid long-term care program that's more flexible and more responsive to the individual needs of beneficiaries and does not discourage working-age people with disabilities from taking a job.
Option. We simply could not afford, not only as an organization, but as a nation, to turn our back on this issue. We couldn't afford to have a survey or another report come out and collect dust. It just simply was not in the cards. And convergence, to me, looking back, was not just instrumental in the formation of this initiative. It's frankly their model. It's their, if you'll forgive the term, business model that they have moving forward. There's something to what they are doing that signals that if we can get more bipartisan consensus around issues like this, we can truly have a transformative effect on our legislature and on the administration itself.
I too would like to thank Convergence and especially Karen. I always like to say that without her, I think what would have happened is we would have spent months and months giving speeches at one another across the table until we finally got tired of it and wandered off.
This is not the end. It's not even the beginning of the end, but it is the end of the beginning. And that's important in terms of understanding what we've done in this report. This is not the end. As we've said, there's lots of work that needs to be done, lots of details that needs to be done, need to be worked out. But we have the basic themes. We have these themes supported by a remarkable array of people, not just in terms of their political views or their philosophical views, but the organizations that they either represent or at least come from are behind this. And so we have the opportunity now to move forward. This is where the work really begins.